Maria Holder Diabetes Center.
Managing diabetes means treating the whole patient, not just blood sugar.
Welcome to the first Saturday in September!
It's September, remember.
Time for you to remember to tune in to VOB 92.9 FM for 15 diabetic-friendly minutes being brought to you with the compliments of the Barbados Diabetes Foundation.
I would like a little birdie to tell me what is happening in today's show.
Let's find out. What are you doing in today's show, Dr. Braffy?
And here I am this morning just to tell you a little bit more about high blood pressure.
Whether you are diabetic or not, make sure and stay tuned to hear what Dr. D says about high blood pressure.
I want to hear that. I don't want that.
Here, dietitian Victoria Cox with...
Really, it's something that you want to avoid as much as possible, especially if you are somebody living with prediabetes or diabetes.
And what is that one thing you should avoid as much as possible? Victoria reveals it all in today's show. All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and what bank is it that can take your financial dreams and make them a reality?
I can answer that question.
Republic Bank. You know you're right.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair. Come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
Morning, VOB peoples! This is Peter Boyce here. Welcome to the weekly health show where whether you are diabetic or pre-diabetic or not diabetic, there's health advice that you can benefit from, including information about the Maria Holder Diabetes Center, which is located up there in Warren, St. Michael, where you can find podiatry services, where if you are diabetic, you can get your feet looked at, eye screening for diabetic retinopathy. Once you're diabetic, you got to do that once a year, and also vascular screening to make sure you don't have no bad circulation or chronic venous insufficiency where your legs will swell up and think,
Romo, if I don't have diabetes at all,
or you might not have diabetes, but you might just want to come and get your health checks to make sure you don't have no high blood pressure and thing. Because you know we got to be very careful with our pressure and also checking for cardiovascular disease, which leads us into our first topic for the morning with one of the doctors you can find at the Maria Holder Diabetes Center, Dr. Diane Braffett. We now say good morning to Dr. D.
Hello, good day. Dr. D here again with you on another Saturday. I hope you all had a great week. Just giving thanks for, all the mercies that have been spared to us over the week that has passed. Wishing you a blessed weekend ahead. And here I am this morning just to tell you a little bit more about high blood pressure. We're taking an opportunity and a moment, I think, to talk more about cardiovascular disease, the number one cause of premature sickness in persons living with diabetes, and unfortunately also the number one cause of premature death, not just in persons with diabetes, but just generally for all people. So this information is great and relevant for all of us, not just persons living with diabetes. So make sure whatever you do learn, please share it with those around you. So I wanted very quickly to talk about some of the signs and symptoms of hypertension. Like diabetes, the most common sign and symptom is absolutely nothing. And this is why you need to be checking your blood pressure regularly. You need to go and do it properly. You need to know how to check your blood pressure properly. And you need to make sure that you do it regularly. It's not something that you do once every 3 years or every 5 years. We talked about risk factors for diabetes. The risk factors for hypertension are pretty similar to those of diabetes. For example, Do you have a family history of diabetes? Are you of a racial kind of origin that has higher rates of hypertension? Are you black? Are you, East Indian descent? Do you have obesity? Are you overweight? Are you physically inactive? Are you a smoker? Do you use alcohol? Do you have diabetes? Do you have high cholesterol? Is this sounding familiar to you guys? Yes. Remember we said diabetes and hypertension actually have a common origin, and that is insulin resistance and inflammation in the body inflammation. Are you having a diet that's high in lots of saturated fats, a high salt or high sodium intake? Okay, so just remembering all those things. So there we have the risk factors. And don't forget, for the younger gentlemen, things like smoking marijuana, cocaine use. Some people think, oh, it's marijuana, no big deal, does not do anything to me. But no, marijuana will increase your blood pressure, does increase your heart rate, does increase your risk definitely of quite severe heart disease and peripheral artery disease. That is the artery narrowing we've been discussing so much that happens, in the lower limbs, yes, but remember that same artery narrowing happens in the heart and in the brain as well. So if you want to get to some of the signs or the symptoms, I'd say rather symptoms of it, usually the symptoms of hypertension are related to the complications. So that means you probably have had high blood pressure for a while, poorly controlled, and now you're having complications. But however, some people go, oh, I can feel it, I know what my blood pressure is. Most of the times you can't really feel it. When you do feel it, you're normally dealing with extremes of blood pressure, meaning the blood pressure is going to be very high. In those cases, for example, you may have headache. Some cases you may have blurred vision. It can actually impact on the kidneys, and you may either be passing less urine. In very rare occasions where it happens very suddenly, you can actually even get a little bit of blood in the kidney, but these are rare. This is rare. Of course, you can have issues like if the blood pressure is so high and it's making the heart work so hard, where the heart can suddenly say, I'm done with this, and you can actually start to get symptoms of acute heart failure, which might be shortness of breath. Basically, the heart can also work so hard that you can even have a heart attack as a result of high blood pressure. But once again, these numbers are normally very high, and they're not numbers that you want to be walking around with anyway, because they will shut down your body, not just the heart, but they can shut down the kidneys and other organs as well. So just be mindful of that.
Thank you, Dr. D. Well, nobody wants their body to shut down, and you out there listening to VOB here, the part where Dr. Diane said this.
And it's making the heart work so hard, where the heart can suddenly say, I'm done with this.
So you don't want your heart to just get vexed and say, done with this. That's why you gotta take care of it by taking it to the Maria Holder Diabetes Center for a checkup. We look forward to hearing part 2 of Dr. D on that very interesting topic next week. All of this compliments of
the Maria Holder Diabetes Center.
Hello? Maria Holder Diabetes Radio Show? This is Alfonso calling. I have a question for the dietitian lady, the food specialist, Miss Victoria Cox. I got a question for you. Sometimes when I go out drinking on a Saturday, I just try to stay away from the hard drinks. Don't get me wrong, every once in a blue moon, I just try hard over the fellas, but that don't be too often. But what I like to do, I like to stick to drinking soft drinks and orange juice and things. So the soft drinks that the fellas will be chasing with, I just be drinking. Now me and them almost got to blows over it. I even had to exchange some words with them, but I don't want with it that right now. I want to be decent. But what I want to ask Miss Victoria is, as a diabetic, if drinking soft drinks and fruit juices, is that really a bad thing? That's what I want to know. Thanks in advance.
Drinking sugar-sweetened beverages, including soft drinks, juices, beverages made from sugary syrups and such, is associated with unintentional weight gain, increased rate of or increased risk of type 2 diabetes and heart disease, tooth decay and cavities. Really, it's something that you want to avoid as much as possible, especially if you are somebody living with prediabetes or diabetes, because sugary beverages will really spike your blood sugar up higher than you want it to go, and that's something that we're obviously trying to avoid. As far as how much sugar should we be looking for, realistically my answer is going to be, if we can avoid sugar entirely in our beverages, that's what we want. You can think of it as every about 4 grams of sugar is about a teaspoon. So when you look at a sweet drink and it's got, 16 grams of sugar, that's at least 4 teaspoons, and it just keeps climbing from there, because most sweet drinks are probably at least closer to 25 or 30 grams of sugar for an 8-ounce portion, and that adds up really quickly. It's recommended that, for example, children should have less than 25 grams of sugar in an entire day, and it's about the same for women, a little bit higher for men, but that's total amount of sugar per day, and you could knock that out in one sweet drink alone. So unfortunately, my response is really going to be sugary beverages genuinely are something we want to avoid, in particular if there's any diabetes present, and instead stick mostly to water. You can drink sparkling water or soda water, unsweetened tea beverages. Then there's also the option of artificially sweetened beverages for individuals who want to go the diet route as well. That won't spike blood sugars.
Thank you for that. Dietitian with the Maria Horner Diabetes Center, Victoria Cox. So all you people listening to VOB, we want to go drinking today, Saturday. Try and cut down on these sweet drinks. Because I know a lot of one out there got a weakness for sweetness, which leads us into our Saturday song of the day. This is Natalie Bird with Weakness for Sweetness. Compliments the Maria Horner Diabetes Center and Republic Bank. So all you people that listen to VOB that know you got weakness for sweetness, call dietitian Victoria Cox at the Maria Horner Diabetes Center, and she can help you fix it.
I have a weakness for sweetness. Weakness for sweetness. Some people say that I'm a diabetic, but this is only one life to live, so I'ma live it. So don't throw no words that knock on my door, cause never have I felt this way before. Women always talk to say I'm obsessed. Men always tell me that I'm truly blessed. I tell them that I love everything that's nice. Sugar cane, lollipop, pineapple and spice. Cause I have a weakness for sweetness. Weakness for sweetness. I have a weakness for sweetness. Weakness for sweetness.
Sugary beverages genuinely are something we want to avoid, in particular if there's any diabetes present.
You want me to back so? Just do it. You want me to give you some more? Just do it. You want me to? Just do it. You want me to?
Just do it. Maria Holder Diabetes Center.
You want me to?
Just do it. Let's stand Paul with the New York connection. Sister Natalie with the Art Foundation. Me and the rise and you are the two. Do a bit together with a dream come true. If you don't have no foot, then you can't win no show. Weakness or sweetness, that is me and you. And this is a be, and I'm telling you that you want this weakness is a natural fact.
Watch how me pum pum roll and tumble. Watch how me belly just reel and bubble.
We now go to a lady who has experienced the Barbados eye screening program.
Well, I found the service is very good, and I would advise anyone who is diabetic, give it a try because it definitely do work. Once you follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. That didn't only just stop there. I had a nutritionist that taught me the right way to eat, and there was a chart that was given for me to follow, so I wouldn't get off track or go astray and do my own thing.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time.
Eye exams, kidney checks, foot exams, these are all part of whole person diabetes care.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100. But members get 10% off.
Dream a dream and watch it become a reality. You can